The live video will start soon. We are just activating the other channels as LinkedIn and as the Facebook. In a minute, we will start our video. The live video will start soon. We are just activating the other channels as LinkedIn and as the Facebook. In a minute, we will start our video. Hello. This video is, I meant to make it live because number one, I wish I can have some discussion from our colleagues. Number two, it's quite important that it doesn't need to wait for preparation and for editing, and some facts should be mentioned, and it's open for discussion at the end of the day. The trigger for this video was this video, which I will show you now, for one of our colleague doctors from Denmark. He is a doctor and medical researcher talking about pharmaceutical companies. Let's hear what Dr. Peter said, and we come back to our talk.
Including sometimes many on the planet. They have so much money that it's unimaginable. And they buy everyone with an influence, including sometimes ministers of health. And of course, when they buy doctors, they start with the professors and chairmen, chiefs of department. And then they educate them so that they can become what they call key opinion leaders. So they can indoctrinate other doctors that some terribly expensive drug should be used and not a cheap one, which might even be better or having less side effects. So medical education is partly corrupted. No doctor should ever go to any educational event where the drug industry has put money in it. Of course, they don't select key opinion leaders that are not good salespeople for them. And if they start talking about harms of the company's drugs or start praising a competitor's drug, of course, that person wouldn't show up next time. That's obvious. My country, Denmark, is regarded as one of the least corrupt countries on earth. But I must say, in healthcare, we are pretty corrupt like the rest of the world. In Denmark, we have transparency about whether doctors on the planet.
I might envy Dr. Peter that he's from Denmark with the least corruption.
They have so much
in the medical field. However, we all witnessed this corruption in our practical life. I don't think any doctor practicing medicine more than 5 years, except he got exposure to this corruption in a way or another. We found lots of situations where the medical rep, for example, the corruption starts from the medical rep. As a start, hello, and give you a pen as a gift. By the way, you are not supposed to take any gift from anyone in the medical field, including the patients. As a doctor, your integrity should not be biased under any condition. As a doctor, your integrity should not be bought. You shouldn't have a price. But the corruption starts from this pen, note, calendar, watch, and the gift will be bigger and bigger as long as he's asking in the pharmacy whether you're writing his medication or no. The more you write, the more you will get. It's like the positive endorsement policy, which the more you write, the bigger the gift. The more you write, the bigger the gift. The bigger your position is, the bigger the gift is. They call it gift, I call it bribe. Dr. Peter is saying they have a lot of money. They are buying professors. They are buying the chairmen, the heads of departments, and in some cases, some ministers. And they educate them to be the decision makers in their territories. Subsequently, as a decision maker, he will be able to set the guidelines and the policies at which all the doctors in this country or territory will follow. And we all know now that the only thing which keeps doctor safe from going to jail in case of any mistake or adverse reaction or side effect or whatever incident is following the guidelines. As long as you follow the guidelines, you're safe. You're a free man, no matter what will happen to the patient. So follow the guideline, you're a free man. Don't follow the guideline even if you made a correct procedure. You are in jail. This is, I can say, the new medical field after what they called globalization. We all believe in the evidence-based medicine. We all like and follow the evidence-based medicine. Evidence-based medicine is the best way to give your patient the most advanced therapy or treatment or procedure known on earth in this time. However, who is defining the evidence-based medicine? Who is evaluating the evidence-based medicine? If Dr. Peter says that in his country the least amount of corruption, I can say that in other parts of the world, corruption starts from the medical students. Corruption starts from giving high grades to the sons and daughters of the professors in the exam. Personally, I witnessed this in my first oral examination in Cairo University Medical School. This was 1984 or 85. For unknown reason, I found myself in the with the group of recommended students. I didn't have any recommendation. I didn't have anyone to recommend it. Actually, it was a mistake to be in this group. So I entered the room of the head of the department. I will not mention his name. With one of my colleagues. When I sit in front of the professor, he asked me, "Who's your father?" I told him he's a policeman. "Who's your mother?" I told him she works as a civil servant. "So you are nobody recommended you?" "No. Actually, this night I had a sleepless night, studying all the night because it's my first oral exam, my first time to sit face to face with a professor to ask me. I had to be very well prepared. It was about blood pressure, the sphygmomanometer of measuring the blood pressure. He asked me about some of the details. I replied. Then he moved to my colleague. Hi, how are you? How is your father?" He said, "My father is good. Thank you very much for asking." Then he moved again to me, asking another question about the sphygmomanometer in front of us. I replied. Then move to my colleague. And how is your mother? Ah, we miss her cooking. When you will invite us to dinner? I, I was shocked. I was shocked. Believe it or not, this colleague is a professor today. This colleague never saw an oral exam because his father is a professor. This is the start of the corruption. Continue the circle of the chain of corruption. Medical reps give you gifts. The gift get bigger and bigger and bigger. Then it's a holiday. Then it's an invitation for a conference. But you need to prepare yourself to give a speech about our medicine. This happened to me also when I was in Malaysia. I was invited by one of the pharmaceutical companies to attend a conference about blood pressure, hypertension. And they asked me to recommend their medicine, in particular, in name by name. I had a speech this day, and my talk was about amlodipine. They asked me to say their brand while I was talking about amlodipine. I felt in this trap actually, but on the stage I couldn't change the metformin which is present, which is written in the amlodipine, which is written in the presentation, to their brand. So while after the presentation, in the discussion, their representative asked me, which brand is better? I looked at him and said, let me give you back the price of the ticket you paid and the hotel night, but let me talk freely. Don't handcuff me in front of people in this way because you just paid my ticket to come here. Everybody laughed in this time, and of course they never dealt with me again, and I was blacklisted to them. But I know lots of colleagues. They get every year 2 weeks in Hawaii, sometime in the Maldives, sometimes in Genting Highland in Malaysia, Singapore, cruise from Hong Kong to Tokyo. Gifts. It's not gift. The result, again, you can see it in the clinical guidelines. In the early 2005, what was the first and second lines in treating diabetes mellitus? Have a revision for all the guidelines you have. You will see metformin is the first line. Second line can be sulfaguanidine, can be glibenclamide, can be glyclazide, something secretagogue, something insulin, sugar lowering. Third line in this time was even acarbose, not insulin. Insulin, we use it in case of some metabolic disorders with the diabetes, even if newly diagnosed. Have a look today. What is the first and second lines in treating diabetes? They couldn't change metformin because metformin nobody can change it. But they changed a lot the second guidelines. In 2005, the monthly prescription for diabetes would not exceed $100. Today, the monthly prescription for diabetes will not be less than $500 to $800. I would follow this in case of much improvement for patients, but the result is almost the same. Yes, we kept shouting in the conferences, we need more innovations, we need something new, we need something to add as a fourth line or as a second, third line. to help with the metformin, with the glypenclamide, so that we can adjust the patient in a certain, because the patient sometimes come with you up to 8. You give the maximum dose and he is 8. 8 is not that high, it's not that low. Guidelines talk about 7. We need to go down to 7. So this 1% sometimes is very difficult, even with adjustment of lifestyle, with food control, with exercise, with everything. This last 1% of the HbA1c to adjust is very difficult. So we used to say we need some innovative drugs, but they brought us some innovative drugs with huge amount of money. When you add it to the prescription, rising it from $100 to $600, the patient will ask, why? Why do I need this? Anyway, who changed these guidelines? The professors. Some sample from my colleagues. The professors who spend in Maldives every year 2 weeks with the family. The professors who has some villa in Hawaii or in Switzerland or in Germany or whatever. These are the decision makers. Another thing, the scientific life in general, medical life. When as a doctor, when I attend a medical conference, I used to have take-home messages with me from any conference. When I was young, in 1995, 1996, I used to go back with a big amount of take-home messages. And these messages changed my prescription a lot. Following the new drugs with new statistics, with I attended a conference 2 years ago. It was about international drug discovery. I am going there thinking that I will take with me a lot of take home messages, which will change a lot in my prescription, or at least it is a start, it's a discovery, so maybe a lack of clinical trial or something, but there is a hope in a year or two to see some clinical things. So I'm going to a medical conference, and I can say for 3 days, I didn't hear one thing medical. Researches a lot. Budget for each research, in my opinion, is not less than $150,000. With the graphs used there, with I know the cost of the CRM to make for you these things is a lot. So my notice was 3 things. I had 3 remarks in this conference. Number 1, all the graphs are the same. They are made in the same company. Number 2, all the subjects were not clinical or even medical. It's a scientific fantasy. Number 3, all of them were funded by one university. The ethics committee of this university, when they approved these researches, which has nothing medical, why they approved it? I don't know. I asked some of the organizers there and some of the professors there, what is the value behind attending such a conference? What is the value behind more than 50 researchers? Each one of them cost $100,000. This, we are talking about $5 to $6 million now. What is the value? Who gained what? Who made any benefit here? Did the patient get any benefit of this nonsense we are hearing? No. Did I, as a doctor, get any piece of information that will help me in my clinic? No. So this $5 million, from where it came and where it went? It went to one CRM company which made these beautiful graphs and these beautiful diagrams. I don't like to have bad intention, but you don't feel there is some sort of money laundry here? Yeah, money laundry. Unknown money is coming. Went to a certain company legally for a medical research. Through a medical student or a medical doctor who is doing some rubbish research which has no relationship to medicine. And some of these doctors who presented, they even cannot memorize the terminology they are putting in their researches, which made me feel as if somebody else made to them this research and he's just presenting. It's not one, it's not two, it's many conferences we attended in this way. We hear some scientific fantasies without any clinical implication or any clinical importance to the patient. This is another mystery which we need to wake up for. Any medical research without clinical implication, without clinical value for the patient or for the performance of the doctor is useless. Why it should be funded? There are many researches need to be funded of value and can change lots of people's life. I come to the last point, which is the publishing, which is another mafia today. It's another. Actually, it's not. I cannot be surprised because it is like closing the circle. Medical research corrupted. Who will publish this? Who will give legitimacy to this nonsense except what they call peer review magazine? Who are the peer? The professors. Are they professors? Are they really professors? Personally, when I remember our professors in the medical school, I am honored to be from Cairo University Medical School. I remember a real professor, God bless his soul, Professor Dr. Muhammad Rashid. A professor, a real professor used to bring us every day, 5 a.m., 6 a.m., giving us free lectures. Professor Dr. Hashim Fouad, Professor Dr. Khair Samr, Professor Dr. Magdi Hussein. Lots of real professors. But this generation is gone. The professors today are the sons or grandsons of these late professors who are not real professors. They are professors take most of their income from pharmaceutical company, health insurance company. They are running after the money. They are biased. And this big bias make us in a dilemma in the medical research today. You have a very valuable research. You send it to peer review magazine. They send it back to you. Why? It's a genuine research. It's a research was professionally done and with a promising result. And they give it back to you. And you wonder why. They say about the language, what is your point? As long as you are taking from me 3,000 euro to review and publish this, I am as a doctor. Why my job should be writing and editing? I wrote the scientific facts. If you don't like the editing, re-edit it. Why you are taking the money? to give it to the professors. The professor, and because I'm not recommended, I'm not a friend, I don't have somebody to add to the committee which will review. I don't have name in this field, so nobody will approve it. Did I see this? Many times. Many times, me and some of my colleagues, we make a genuine research and we send it to this peer review, declaring our acceptance to pay the needed fees, and they send it back to us. So one time I replied to the email which rejected the research by, was the methodology has anything wrong? Was results not satisfactory? Is there any doubt about anything here? This research was done by me personally, and I passed it to a third party to validate the results. And this third party is a national research institute with lots of big professors, maybe better than the one who reviewed and rejected the research. So why you are rejecting it? There is no reason given. They don't give you a reason. It's invaluable. It's not important. It's a clinical research. By the way, one of them was about the COVID with results, very promising results of 97%. They didn't like it. Because I'm not part of the mafia which collected them together to be able to publish with them. This all and many more, if I continue, this live video can continue for hours and hours and hours about stories we saw or we witnessed or was documented here and there. We need to stop. We need to come back to the time when the research was evaluated by its scientific value. We need to come back to the time where we practice medicine according to the real best evidence, not the most expensive medication to be used. We need to write medicine to our patients according to our best knowledge that this will be beneficial to them. I cannot trust medical researches, published medical researches today. Who said it is not tailored? Statistics can be manipulated very easily, can be played in very easily, can be biased. Change one number, change the methodology, you will change all the research. So we are not able to trust today any medical research we can get. We cannot trust the numbers. And as long as we cannot trust the numbers, how we will be able to validate anything? How we will be able to practice according to the evidence, the best evidence we have? What is the best evidence? We don't know. No numbers are accredited. The integrity of the professor himself who wrote this is biased. We will have a continuation to this video later. I wish you all good luck. And in case of any question, please do not hesitate to communicate with me. Thank you.